We are very honored to have Dr. Matthew Kwa, a family physician, for an interview on cervical cancer. He has prepared the equipment used in the cervical cancer screening test, in which he will explain to us how the test is performed. Nice to meet you, Dr. Kwa.
It's very nice to meet you. Dr. Kwa, in your opinion, why do women need cervical screening tests?
Cervical cancer is the cancer of the cervix, which is the lower part of the uterus. It is ranked the 5th commonest cancer in women. Early diagnosis and treatment have good chances of complete recovery. Therefore, all women after the age of 25 should have regular cervical cancer tests to detect early cancer changes and prevent complications and death.
What is your role as general practitioner in the screening test of cervical cancer?
My role as the frontline general practitioner is to detect and prevent cervical cancer by providing the screening test. Every female patient over the age of 25 is asked at some stage of consultation, do you have a cervical smear done before? If the answer is no, I shall explain to her the importance of having this test performed. If the test is yes, I shall advise her to join the cervical screening test program.
I see. How is the screening test done?
It is a simple, easy, and non-invasive test that takes only a few minutes. With the patient lying on the couch, a speculum is inserted into the vagina to examine the cervix. By using a special spatula or a brush, a small amount of tissue is taken from the cervix and smeared on the slide. The slide is then fixed by a spray. And inserted into the specimen box. Or put inside a specimen tube. The specimen is then sent to the laboratory for cytology examination.
What kinds of women have the high or low risk of developing cervical cancer?
The high-risk women are aged 25 to 70 who have sexual experience during this period. Infection in the cervical region and smoking increase the risk of cervical cancer. Women below 25 who have early smoking habit, sexual experience, and genital infection such as bleeding or excessive foul discharge from the vagina should have the test done early. The low-risk women are those who never have sex and who have negative results with regular screening tests. These women may have the test stopped after the age of 64.
Dr. Kwa, how do you evaluate the test results after women have taken the cervical test?
We divide the results into 3 classes. Firstly, the negatives. Secondly, the doubtful. And thirdly, the positive. If a negative result is obtained, the screening test will be repeated in 1 year and subsequently every 3 years. For doubtful positive results, the test is repeated in 3 to 6 months. All positive test results are referred to the gynecologist for further treatment. With this screening test program, early cervical cancer changes may be detected and early treatment will facilitate simple and complete recovery.
Dr. Hua, we have one last question for you. How does the community as a whole get to know the effectiveness and the result of the screening test?
The Department of Health has launched a territory-wide cervical screening program in 2004 to reduce the incidence and mortality of cervical cancer in Hong Kong. A cervical screening information system, CSIS, is set up to register the smear test results and to assess the incidence and effectiveness of the screening test. All medical service providers, including doctors in private or public sectors, family planning, women's health centers, and hospital authority clinics, are collaborated in this program. The government is aiming at 80% of program coverage in 10 years. With combined efforts from various sectors, it is hoped that the cervical cancer rate in women of Hong Kong may be reduced to a minimum.
As we conclude this interview, Dr. Kwa, could you please give us a few words to summarize your advice?
I would advise join the cervical screening program early and register with the CSIS to help our government in the evaluation and prevention of the cervical cancer.
Thank you very much for your time, Dr. Hua. It has been a much informative interview.
Thank you.